What are the most common cofactors that I see in my work with anger management? And I want to thank somebody named Jason for emailing me this question and suggesting that I respond with either an article on my website or a video. Thank you so much. I appreciate it. And I'd love to talk about that. Just a little bit about my background. For the last 16 years, I've focused my practice on helping people do a couple of things. One, learn to manage their anger. And two, learn to heal the roots of their anger. And three, learn to fix and repair their relationships that have been damaged, hurt, sometimes broken, by their anger. So, what are the most common cofactors? I would say that probably starting out, the big obstacle for many people is that they have some sort of a substance use or an addiction issue. There's drugs or alcohol in the picture that is interfering with their brain's ability to regulate their emotions. So if you're actively using and abusing drugs, then of course you're going to have difficulty recognizing your feelings, and you're going to have difficulty regulating your reactions. So that's the first cofactor that I think is just very common in our society. The second cofactor is what I call untreated trauma, and that can be trauma. A quick definition of trauma: I think of trauma as an event or a condition that is overwhelming to your brain and your nervous system's capacity to integrate. And I won't spend a lot of time on that, but trauma can be either a major incident that occurs, like an accident or a crime that's been committed against you. It's usually something in which you feel like you were frightened for your survival. And so it could be a major incident, or it could be an enduring condition. And trauma can even be developmental if you grew up in what I call a high threat family, meaning it just didn't feel safe. It didn't feel okay to be there. Then it's very likely that you're going to have difficulties with either anger or anxiety or depression. Your system is just going to be prone to having those threat responses of going into fight, flight, freeze, or collapse, submit, withdraw. So trauma is definitely a major cofactor. It's something I see every day in my practice. And the next common cofactor is stress and anxiety. If you think about it, of course, if your system, if your body-mind system is carrying a lot of tension and stress and fear, then you're just not going to have a lot of bandwidth, and you're going to lose your cool. You're going to be overcome with frustration and impatience and anger. So stress and anxiety is another big cofactor. The next one is probably depression, and often people will be dealing with the depression, and the anger actually serves to kind of lift them out of the depression, to give them some momentary relief. So it's very important that if you're dealing with depression, that you be in good, effective, quality psychotherapy. There are a lot of skills and tools that we know can really help you if you're feeling depressed. And that's also true for anxiety and trauma, the cofactors that I've already mentioned. So I think those are probably the main ones that I see, or the ones that I see most regularly. I hope this information is helpful for you. And again, I want to thank you very much for submitting the question. And if I can help you in any way, if you would like to stop anger from damaging your most important relationships, then please feel free to contact me. I'm happy to spend a few minutes talking with you to see if I might be able to help you. So thanks so much and have a wonderful day.